Good afternoon, everybody. We have a lot of work to get done today, so we are going to jump right in. Jules, do you just want to quickly review who's in attendance for the members of the public?
Absolutely. We're still upticking in attendees real quick. Looks like, at least on my end. All right. Looks like we're stagnant. So yes, like the secretary said, welcome everyone. Thank you to our committee members for attending this third HVAC meeting of the 2024, looking at fiscal year 26. So we have currently present, Representative Bolden is absent. Senator Richardson is present.
Present, yeah.
Mr. Fulton is present in person. It looks like Miss Massa is connecting, so we'll come back to her. Representative Baumbach is present. Chair Manning is present in person. Mr. Patel is logged on, it looks like.
Julie, I just wanted to let you know, if it's okay with you, I would be listening in mode only from 3 to 4. I do have to attend something that I could be on the mute though.
Thank you, Mr. Patel. We appreciate you joining. And then we also, Dr. Silver is on. And then it looks like Miss Massa just jumped on.
Okay, great. Thank you.
Yep.
All right, so our first order of business is to approve our minutes. We have minutes from the 9/19 meeting as well as the 10/15 meeting because we were not able to do the 9/19 meeting minutes last time. So if everyone's had a chance to review them, if we can start, we will do them separately in case people have to abstain from either vote. So on the meeting minutes from 9/19/24, are there any questions, concerns, edits, or motion to approve?
I make a motion to approve the minutes for the last week.
Thank you, Mr. Patel. Is there a second on that motion?
I'll second. Done. Fulton.
Thank you, Mr. Fulton. Any objections? Any abstentions? All others in favor say aye, please.
Aye.
Aye. Okay, those minutes have passed. Moving on to the 10/15/24 minutes. Are there any questions, edits, or is there a motion to approve?
I'll move we approve as published on Fulton.
Thank you, Mr. Fulton. Is there a second?
Second, Representative Baumbach.
Thank you, Representative. Any opposed? Any abstentions? All in favor can signify by saying aye.
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 All right, the minutes are approved. Thank you. Okay, so now we are going to jump right in to the application discussion. Jules, do you want to introduce the presentations?
Absolutely. And just to recap where we left off was we had 2 programs left on our intentional invite list from the new programs group and or the workforce group. To hear from them, those were 2 program categories that the committee was interested in hearing more from. So we'll first hear from Mr. Greg O'Neill, who shortly I'm actually going to promote you to panelist shortly. We'll hear from him with Health Literacy Council of Delaware, and then Dr. Tracy Harp with DSU's nursing program. So before I move into elevating them to begin presentations, I wanted to ask the committee members if they had anything else before we jump into this. We have a lot more on our agenda that might come with discussions. Yep.
Jules, I'm looking at the HVAC applications and it's alphabetical. I don't see housing. What was the organization name?
Health Literacy Council of Delaware. Well, let me jump into the application file names and see if I can match what it's named in the file for you.
Thank you.
So I don't know if you maybe have that in email too and can start to pull that up. I do believe it's Christiana Care. It might be in their folder. actually, now that I'm thinking of it. And I'm actually going to elevate Greg so he might be able better to speak to that as well.
Is it HLCD?
Yes.
Okay,
Mhm.
yep, it's under Christiana
Yes,
Care.
that's-
Thank you.
Yep. So Greg, I'm going to promote you. He's joining as a panelist. Welcome.
Believe I'm
Greg.
connected. Can you hear me?
Yes, we can.
Okay, awesome. Thank you for having me back. I'm going to jump into a quick presentation just to kind of orient everyone to our application. Secretary Manning and HVAC committee members, thank you for what you've already done for the funding award from this fiscal year. We're very excited about that. So right out of the gate, wanted to thank you for that. And I'm going to do my best to make a case for why you should invest in us again. This is an innovative approach, and I think you'll like what you see. So let me jump in. All right, assuming you can see my screen.
We can.
Yep.
Okay. So I just want to level set with everyone. I was on the previous meeting. I know you guys are ready to wrap up these meetings, so I'll be as efficient as I can in this presentation. And I know you're asking hard questions of all the groups, so I fully recognize that you guys have a tough task ahead of you in the term of signing these dollars. So let me just come out of the gate and say that the Health Literacy Council of Delaware is very efficient and effective in the work that we're doing. My role is actually my real job is at Christiana Care as the Director of Patient and Family Health Education, which you can see here. So my role as the chair of the Health Literacy Council is a volunteer role, and that is also the case for all of the folks serving on the council. So there are no funds going to pay anyone to do this work, but yet we have made a lot of progress as a movement. And I think you'll see that in the short time we've been rolling this endeavor forward, we've made a lot of progress. So hopefully with your support, we can continue to do that. So again, thank you for what you've done. And just a quick comment on equity. Our primary vision is to help contribute to health equity through literacy. And with all of the organizations that you guys are confronted with and trying to support, I just have to say that I think it's going to be difficult to achieve our health goals and certainly our health equity goals unless we address the issue of health literacy. It's just simply too important to how people approach their own health and how through our systems of health are built to support them. So for anyone that doesn't remember the presentation from last year, I'm just going to really quick level set again. We have a lot of work to do in the state related to health literacy from the data. We have a general literacy challenge in our state, and that carries forward to health literacy as well. So any of the areas that are orange or red, we're going to see being in the lower quartiles for health literacy, and that's really why we're here trying to do this work. A quick overview of the council. Our mission really is to bring the whole state together. So if you had a chance to look at any of the pre-read materials that I sent to Jules, you'll see a lot of the stuff that we've been doing is about bringing all of these different sectors and stakeholders together so that we can all be using a unified strategy within the state to address health literacy. So this will help align everyone's missions. It's going to improve safety. It's really going to make things more efficient. And when you make care more understandable for people and their health issues more understandable, you're going to enhance quality of life. And if they happen to encounter any healthcare experience, it's going to improve that as well. So really quickly, you had this already in the materials, but hopefully you saw in our strategic plan that we've developed, a multifaceted approach to improving health literacy in our state. And you may be asking, okay, what does this have to do with the HVAC? Well, we can target our efforts in any vein of healthcare and health education. So we certainly can do that with the understanding of trying to focus on cancer prevention and trying to reduce the amount of tobacco use in our state. And we've done that already, and we're going to continue to focus on that with your support. Just to highlight a couple of key things here, you will hopefully have gotten the pre-read materials and saw that we now have an online presence, which is fantastic. So we received a grant from Highmark Health Options, and we were able to stand up a really comprehensive online presence through our website. I'll share more about that later. But that was a major achievement for us to really start connecting the dots. We've also been able to secure over 120 vouchers for what is really the best-in-class health literacy specialist certificate training program. And our goal is to train as many folks in the health sector and related areas to be health literacy champions. So that work is well underway. I'm really proud of and excited to have all of those vouchers already in flight. And some of them come from your funding, so thank you. We did try we tried a piloted program with the Cancer Prevention Screening Program, Screening for Life. It was fantastic. I'll share a little bit more and let you see what that resulted in. But what a fun process! What I think a value add we will bring to the screening programs in the state. So just to quickly walk you through our new online hub. We are providing comprehensive resources for best practice. So this is that everyone in the state should be using best practice. That includes all of our cancer prevention programs, screening programs, tobacco cessation programs. If we are using best practice, we will be more successful in all of our endeavors. We are going to be doing a ton of community engagement. We just had a very successful October, which is health literacy. And during the month of October, we had many events posted on our events calendar, including a couple that I'll highlight as we go forward. And then we want to give people the ability to take action, find training that works for them, connect different stakeholders in the state to work on projects and things like that. So this is really kind of an exciting endeavor for us to have this site where we can kind of house everything. I won't go too into depth because you can play around on the website and look at it, but really engaging people at where they are, because some folks are ready to dive in full force into health literacy, and other folks are just kind of dipping their toes in. We've got a tiered training recommendation there in the middle, where we can have folks engage at a very light level or dive deeper and deeper into building skills. And then what we really want to do is create and we're already creating a bunch of champions around the state who can not only improve the process for each person that they're interacting with, but improve the systems of care that we have in the state collectively. Again, I'm blazing through this, so hopefully you'll ask any questions that come up. Just to give you a quick sense of who we've got involved in this council. Again, this is an entirely volunteer council effort. We are very effective and efficient in our use of contractor services for some operational and logistics support. But all of these folks from all of the health systems and public health and even some payers are helping this work move forward. We're super excited to be launching this winter a member portal where everyone will be able to see and collaborate and work on all of the efforts and projects that we have going on. So that'll be an access-only member portal. And we've also developed a way for each organization, be it a giant health system all the way down to a community-based organization. We've developed an online scoring tool to see where am I at in my health literacy journey. And then from there, you can start creating your own strategic plan about how to bring those best practices to bear. And of course, we would focus those efforts in your areas of interest with your funding. So I thought I'd throw this up there. I just saw Don Hollinger today at the Health Forum down in Dover, which I happened to be attending. And I said, I hope it's okay, I'm using your quote today. This was the end result of working with the Screening for Life folks on really trying to produce something that meets the health literacy need of those vulnerable populations we're trying to reach. So we created a conversation guide for community leaders or those trusted folks in the community, and then some consumer-facing assets in English, Spanish, and Haitian Creole, really going to drive that engagement into the community to try and improve our screening process. So super excited about that. It hasn't made it to the Healthy Delaware sort of online catalog yet, but very soon, Dawn assures me that will be available, and we'll start driving that process. Again, just reviewing everything we've done. This Health Literacy Council has only been around for about 2.5 years, and it's amazing how much we've accomplished. So the movement is really happening. We've got another proclamation from the governor this year for Health Literacy Month. We are going to be launching this spring a first ever that I'm aware of public campaign on health literacy to try and skill build and empower our community members themselves. So I'll show you what that looks like. We have panel discussions. We do a lot of educational activities. And I think the main thing is our online hub that we have now. And we were also successful in embedding health literacy into all of the state health, community health needs assessments. So all of our major health system needs assessments will include health literacy questions. So we will have some more data. Really excited about that. I think we're the first state to coordinate that in that fashion. And then next year, we're going to be building out our Delaware Health Literacy badge program as well to really recognize those folks like the Division of Public Health, like HVAC, folks who have really jumped in and supported this innovative approach, invested in us, and are skilling up their workforce. So we're very excited about that. Just to give you some eye candy here to look at, you can see some of our major partners up there at the top helping make all this happen over the last couple of years. Some of our best practice assets that I've been handing out these cards all day at the Healthcare Forum in Dover. And then we also put together a really comprehensive toolkit for anyone in the state to be celebrating and kind of pushing out the message about health literacy during October. Just to give you a sense of the engagement that we're getting already, just since July when our website went live, we've had 1,000 folks check out the homepage and reach all the different pages within the website. Our open rates from our various emails are pretty high compared to industry standards, 43%, and then a click-through rate of 14% for folks filling out, wanting more information from us from the website. And then we've done 3 email campaigns just in the last couple months, and the click-through rate is very high on that as well, 30%, with the industry average being 2.6. So all of that just to say, everyone I talked to today, everyone that I've engaged with this council work is super excited, and they see the need. So we're doing the best we can to put together a comprehensive program. This means partnering as much as we can as well. So we are a part of the Delaware Literacy Alliance, which also is just trying to raise literacy awareness throughout the state in general. In October, we held our premier event, which you'll see in the middle there, which you'll actually see. We have Adriana Rivera Sosa from the Breast Cancer Coalition with one of our panel members. Fantastic session where we had a panel that included real patients, real community members, so that all of these folks in these different roles could convey their perspective on health literacy. It was fantastic. And then this, I just wanted to give you a visual of what the certificate program is, those 120 licenses that are in flight. It's well over $250,000 in value, but we got a discount as a state through our council. And this is going to make a lot of people in Delaware the best health literacy champion it can be. And this is kind of democratizing that championship throughout the state. So now getting the message out, you'll see if you're on LinkedIn or other socials, you'll see some of our messaging. On the left here, you're seeing an example of our community-facing campaign that we're going to launch this spring. Also on the right, there are a couple of skills that are essential for people when they have a healthcare encounter. We want to empower people. We're going to make those co-brandable, so any org in the state can take advantage of those. And you'll see us with all kinds of activity on social media. So that is the super quick version of what I wanted to share with you guys today. And now I'm open to any questions.
Well, thank you. I appreciate the presentation. This is Josette speaking. Hi, how are you? I just wanted to ask a quick question about the funding for FY25. You all were awarded $200,000, and with the intent of focusing on tobacco and cancer literacy. What
Yes.
is, and I understand that you either probably just received it or may not have received it yet. So
Not yet.
what is the plan for those funds and specifically? And how is that different from the request this year, or is the 200 part of the larger 400 ask?
We're asking for it again. Essentially, the funding from this committee is helping keep the operation alive. So thank you for that. When you're starting something new, you kind of cobble together funding from where you can. So we have DPH to thank for that. We have Highmark and we have you guys. The thing we want to do is focus the activities. So we haven't gotten the disbursement yet, but when that comes in, we are planning to reach out to anybody who has any sort of cancer screening or cancer-related activities in the state, and any tobacco cessation activities, making sure that their folks have first access to those training certificates, making sure that they feel supported and have a plan. If they want to do continue pilot projects, I was just talking to Don at the forum today. There's more work that we can be doing to support the Screening for Life program and DPH. Really, it's going to be focusing any of our activities around, what is of interest to our funders. So while we're building an organization and building a movement at the same time, which is going to lift all boats for our health systems and all of our community-based organizations, we fully recognize we're going to hold events. We're going to have legislative breakfasts. We are going to have more on virtual panel sessions that are focused on these areas. We have a new, one thing that's different about the application this year from last year is we had the idea of offering a sort of barrier relief payment to folks to try and drive engagement in the community and screening. So if somebody has a desire to go get cancer screening, but there's some kind of barrier like transportation or employment, can we help offset the cost of those things and reduce that barrier directly? So that's kind of our referral program that you saw in our application. So I think there's a lot of creative things we could do to couple how we communicate with people in plain language and skilling up anyone who's trying to do that, and then also meeting the community need directly through our engagement activities. I hope that's helpful.
Yes, thank you.
Okay.
Were there other questions?
Yes, great. Don Fulton, as I know you're aware, having sat through these meetings, our funding amounts are decreasing.
Yep.
And in a time when we have decreasing resources, you guys are asking for double the award from last year. I'm wondering a couple of things. One, would it dramatically affect the program if you only got the same award as last year, number one? And number two, are you seeking other funding sources? For example, I see you're partnering with the Delaware Literacy Alliance.
Yep.
Is that a source of funding for you that might offset something you don't get from these funds?
Yes, yes, and yes. I am very grateful for the funding. So I honestly, whatever you guys decide, I will be happy and graciously accept. The reason we asked for 400,000 again is that's what we asked for the first year. I have been working on this project basically on the side of my primary role. So you'll see in our first application, a big chunk of that was to hire an executive director. Well, with half of the award last year, we weren't able to do that. So we worked with our contracting services to acquire more hours from them, kind of in lieu of having an executive director. So we would do that again and, and keep the lights on. So the answer to your first question is if you funded us at half, I would graciously take it and make it really go far. The second question about other funders, absolutely. We are submitting grant proposals. And as part of the Delaware Literacy Alliance, we are starting to coalesce around the idea of a joint funding push to fund multiple organizations, including this council, through that alliance. So we will continue to seek other funding for sure. But at the same time, you have to keep things moving. So right now we've been doing that. We were able to make our Highmark grant stretch another 6 months past when it was really kind of intended. So we really are mindful with the money. And, I think you guys are early investors. So if I was starting a company, I would consider you guys the early adopter investors, along with some other key folks. So appreciate anything you can do. I understand the hard questions you were asking everyone previously. This is a scale that I think is different than some of the other applicants. Honestly, we have the potential here to reach thousands and thousands of people throughout the state if we are moving as a collective action. So you guys will have kind of be stuck with balancing all of that in your decision making, and I don't envy you, but very much appreciate the opportunity.
Thank you. Jules, were there other questions online?
No, I think we're good on my end unless other committee members had questions. I real quick want to acknowledge Senator Poor is present. Thank you, Senator Poor, for joining us. Excuse me. And then also, Ms. Tuxford, I don't know if I acknowledged that you were here as well. Welcome. And I did see Dr. Lee, I thought as well. Yes, Dr. Lee is also here. So I've marked all of you present. I apologize if I missed any of you at the start. But Greg, thank you so much for joining us. I don't see any other committee members indicating questions. I don't see any in person either. So Greg, if you plan to attend the rest of the meeting, I'm just going to ask you to go off camera. I don't think I can demote you back to the public. It somehow kicks you out. So I'm going to go ahead and elevate Dr. Harp with DSU.
Thank you so much, everyone.
Thank you, Greg. Okay. Dr. Harper, I'm about to promote you. You'll get a request to promote. You'll just accept that. All right, Dr. Harp, can you hear us?
I wasn't unmuted. There we go. Thank you.
Awesome.
How are
Welcome.
you? How are
Thank
you?
you.
I do have I have a PowerPoint. Do you want me to go from here?
Yep, you should be able to share at the bottom of your screen, and you can control from here. And just thank you for joining us. We appreciate it.
Okay, great. Let's see. So I'll share. Let's see. All right, you tell me if you can see my screen. I have a double, like a triple screen here. So I think I'm going to move it over. I'm going to stop sharing because my screen is so large that it's not the regular size. So I'm going to move it over to my other screen. Sorry about that.
That's
And then I'll just move you over. There we go. Can you see it now?
Yep.
Yes.
Yes, we can see it.
Okay, I'm just going to move us out the way. There we go. And I will go into, there we go. Okay, can you see everything?
Yes.
Yes.
Oh, okay. All right. So I have Miss Devonna Fields with me. She's our simulation coordinator, and she works with our students. So I invited her to be with me because I wanted her to be able to talk about the simulation program, which is a really big part of what we're doing to help our students be more successful in the program. And thank you for the invitation. I was really excited to be here and share what we're doing. It's not moving. There we go. All right. So the Wesley College of Health and Behavioral Sciences is where the nursing program is housed, and it's the largest college at the university. The nursing program is the flagship of the university. We bring in the most students in freshman fall, for freshmen, and we bring in about maybe 350 to 400 students. Now, of course, those students over the course of time will change their major, but for the most part, we bring in quite a few students. Also in our college is psychology and social work. We have public and allied health. Not mentioned here now, we have kinesiology, and then we have nursing. So we're working to transition our students from pre-nursing to the professional phase of nursing, and we aspire, to really graduate qualified nurses, and we want those nurses to be ready to join the nursing workforce. We also do collaborate with the hospitals in the area, and we're always in discussion about how we can prepare our nurses when they are new to practice to really be able to, start working and dig in and really be prepared. When we're talking to the hospitals, they mention how some of the new to practice nurses don't quite seem to know how to conceptualize, what they need to do all the time, and they're getting a slow start. So we're working on that as well. So the nursing workforce, the National Council of State Boards of Nursing, they published a survey providing nursing updates that include employment trends in the nursing workforce, and they also hosted a symposium addressing the nursing workforce crisis. The survey found that 62% of nurses reported an increase in their workload during the COVID-19 pandemic, and we do know that. Along with the increase in the workload, a quarter to half of the nurses reported feeling emotionally drained, used up, fatigued, burned out, or at the end of the rope. So if you look at those statistics, it's pretty alarming. While the pandemic increased pressure on everyone, it also resulted in an exponential increase in workload and stress for nurses. That's when you begin to see a huge mass exodus out of nursing. So also the survey talked about 100,000 nurses left the workforce due to the increased pressures from COVID-19. And then while healthcare is already feeling the burden of this loss, they project that nearly 1 million additional nurses, including 800,000 RNs, because, when we talk about nursing, we talk about LPNs as well, may leave the profession. So, some of the reason the nurses gave for leaving, including the nursing calling out and being short on the floors, and then again the new to practice nurses not being prepared, and that has been the focus of our program, just following what the trends are. So what's happening at DSU? We started an ATI launch program. ATI is the program that we use, and it's the Assessment Technology Institute, and the program is used by 70% of nursing schools to help students learn and master important nursing concepts. And ATI survey conducted in 22 found that 71% of educators had observed students struggling with their program, and 46% has seen an increase in first year attrition. And we definitely see the same trends. And then separately, an ATI survey of potential nursing students who took the TEAS exam, which is the entrance exam into nursing, they in 2022 reinforced the faculty observations. And from that, 35% of the respondents said that they felt academically unprepared for nursing school. So when we talk to our students, when they're first coming in, they're very excited, and they don't acknowledge not feeling prepared until they get maybe when they get to their junior year. When they get to the junior year, we see it more. And then also, we know that nursing students do not enter into the nursing program, particularly the professional phase, on the same footing. So what we did was we looked at what the ATI program offered, and we decided to see if it would fit for our program. We know that nursing students begin with deficits, so we wanted to put them on equal footage. So we started the ATI launch program. So we are a 2+2 program. So we have 2 years pre-nursing and we have 2 years professional. So this past summer of 2024, we offered 60 incoming juniors. We brought 60 students in, and each student was given the launch program. We funded that, and it was it's a 6-week program. It's student paced, and it's academic support to reduce attrition and ensure success for nursing students. Some of the features: a customized study plan, tutorials, assessments to support unique learning styles, and media-rich content explaining and clarifying key concepts. An integral part of the program was the faculty student mentor piece. So within the program, ATI provides a faculty mentor that watches the students and monitor their progress throughout the 6 weeks. But we had faculty on our end as faculty mentors to monitor that as well, to make sure, because it's the summertime, the students are working. A lot of the students that are out of state, and, getting prepared to come back. And we wanted to make sure that they stayed on task with the program. And so our faculty mentors monitor them from this end to make sure that they, each week they were doing what they were supposed to do, and then to troubleshoot, any problems they may have had. 59 of the 60 students completed the program and was admitted into nursing. And we follow, the students in, and that group of students now are juniors. They are juniors in their fundamental class. And so we're going to follow these students all the way through their journey into the program. And we're going to collect data to see if the ATI launch program really had an impact on our students. We're going to create some surveys to, just to see where they came from, where they are, also how they feel about the program and how it helped them. And then do some comparative data from our students before we had ATI launch, and then, our students afterwards. And then the next piece, Ms. Fields will talk about, which is our simulation.
Good afternoon. So again, my name is Devonna, and I am the simulation program coordinator. Simulation is obviously a tool that has been well researched on how impactful it can be for student success. It's another initiative that helps support students, help close those gaps in critical thinking. Our program started back in spring of 2023, and DSU has always had simulation, but it hasn't to be put into a structured program, to have someone in place to totally oversee it. That was my position. And so in spring of 2023, we began utilizing simulation with our juniors and developing that more structured program. And by the fall of 2023, 88% of our NUS courses, our nursing courses that have a clinical, were utilizing simulation in their classes. So as you can see on the screen there, by the time this class, which at that time they were juniors in that year, when they got to their senior year, they take a couple of tests. And so one of the tests that we give them, which can see where they are as far as academically, is our comprehensive predictor. And so this class, who was the first class to have experienced simulation to this degree, got 98% of them scored 90% probability above on their comprehensive predictor on the first try. And from what I know about this program, that was the first time that was ever has been accomplished. That was a huge milestone for us, and it really reflected how impactful simulation could be for them. And also another exam that they get in their senior class in that spring of 2024 was the ATI probability predictor for passing the NCLEX. So what this test does is we give it to them, and it lets us see like how well they will be able to do when it comes to doing the NCLEX exam, which the NCLEX exam, if you're not familiar with that, is the test that you have to pass after you graduate to get your nursing degree. And so our score increased from the previous class up to 92% with this class. And so it was a 14% increase from the previous 2023 year. So we were really excited about that. It really kind of helped us see, wow, this was really helping them. Along with doing simulation, we have implemented disaster drills, and it helped us with forming some community partnerships. Back in April of 2024, we did our first active shooter disaster simulation. And we partnered with the manager, the emergency preparedness manager at Bay Health. We also partnered with our DSU campus police and also our Dover police departments. And we combined efforts, and we created an active shooter disaster simulation, and where the students would then come in, and they worked along with Kent County paramedics to treat our patients and do that during that simulation. Not only did we have them involved in this, but not only did we have the Bay Health emergency manager, but we also had other experts who helped us out with consulting throughout the time of this, because we started meeting for this back in August. So we had 8 months of meetings to prepare for this because we knew it would be a huge undertaking. We also brought in Dr. Parisi, who is the director of our student health services. And we thought that was a very important piece because he's over the mental health portion of our student health services. And we know that active shooter, sometimes that can raise some apprehension. So we brought him in to help us out in the planning to make sure that our students were going to be psychologically safe for this disaster sim, and it worked out really well. And we are working on it again for this year. So in April 2025, we will also not only be working again with our Dover and DSU campus police, we are still partnering with Bay Health emergency manager, but we're also going to be partnering with Del Tech paramedic program. And so we're all starting our meetings now to prepare for April 2025. And so we're looking forward to having another successful simulation that is not only helping us build community partnerships, but also helping us to prepare our students to be successful. Along with this, we have what we're going to do as far as moving into the next phase. And so we really appreciate the funding that has helped us with our simulation program. It has helped to purchase equipment. It has helped us to be able to be more structured. Another thing that the funding is going to help us do is create our standardized patient program. If you're unfamiliar with this, standardized patients are utilized because it gives your students exposure to real people. So we love our mannequins, and even with our high fidelity mannequins, they can make them very lifelike, but nothing beats having a real person sometimes to interact with. And so our funding is helping also to promote this, and standardized patients are patient actors. They are trained with certain standards. They are trained to act in certain ways. They are trained to follow a script and to interact with the student, and then also give the students feedback. So we're looking forward to implementing them within the next spring or fall. We're also moving into where we're going to get our NACSL endorsement. And NACSL, as you can see, is the International Nursing Association of Clinical Simulation and Learning. And NACSL is the creme de la creme of simulation. They set the standards. They're known worldwide. And so we're looking and moving toward collecting data now so that we can move to being endorsed by them, which will be another huge milestone for our program. And then after that, we're looking toward getting program accreditation, which is what a lot of universities have done also. And that just puts a huge stamp of approval and just makes it feel like, your program is top rate. So that is what is coming in the next 2 to 3 years. And I will turn it back over to Dr. Hart for community programs.
Okay, so for some of our community programs, one of the things that we did last year, and again, we're trying to make sure that we are, getting out into the community more and more. So we partnered with Fairview Elementary School, and we wanted to do fit and fun. So we did activities around food or nutrition, and then also exercise and moving. And that program was very successful because we brought our some of our students that were tied to the community program, and they were able to create games for the students. We did it outside. It was in the in the yard, and the students were so excited. We had we made like different games that they could really see and understand. Like we did it on their level, that they can understand what food is, how food impacts their body, and how movement impacts their body. So that was something that we were really proud of. And what we're working with now is we're seeing an increase of vaping. We're seeing it here on our college campus, which our college campus is a no smoking zone, whether it's vaping, smoking, or regular smoking. So we are a no smoking zone at our university, but we're seeing that students are vaping. We see evidence of it. And then we're partnering with the high schools, but right now we're going to start with the Dover High School after school program to do some education on vaping. It's something that's like really needed. We do a lot with some of the smaller children, like at elementary and middle school, but we're going to focus now, do some focus on high schools so that we can see if we can make an impact there. One of the other things that we want to focus on also is that when we talk about food insecurity, we have been looking outside, and we have food banks, and we try to, especially in the Capitol Park area, we try to make sure that we address food insecurity with education and also with our food bank. So we kind of pair them. But we found out that we ourselves in our Delaware State University community, our students don't always have the money or the resources to buy food like they should to be well nourished in order to function. And we identified that by accident, and we have made a huge effort to partner with food pantries, and we have a food pantry person that is, in addition to what she's doing on the university side for the community, we have a student lounge, and we have a refrigerator in our lounge, and they are putting things in the refrigerator for the students, and it's being used. So nothing is going to waste. So we knew that we really stumbled upon something there. And even before that, just the faculty, just on our floor where our offices are, different people have like little tables and stuff, and they put like candy out, for the holidays, where they put snacks out. And we noticed that the students were kind of peeping around the corner to see if they could or maybe could not have a snack. And we were, just asked the question like, come, you're welcome to the snack, and then just started questioning them about their eating habits and, what they do and how they maintain their nutrition. And we found that there was a huge gap there. So we're trying to address that as well. So we have some exciting things coming up, and hopefully we'll see some impact. So I'm going to stop sharing, and I apologize because I'm used to Teams, but I'm not too used to Zoom. Oh, okay. I see it. Thank you.
There you go. We have you back. Thank you. That's perfect.
Okay. Let me go back on. There we go. Okay.
Okay. This is Josette speaking. I just want
Hi.
to, for the committee members, note that for the nursing program specifically, you all received funds in FY '24 and then a $30,000 increase in FY '25 to $214,000. Your request this year is about 5 times that, coming in at $1 million. And you did not meet your goals last year on the master's program. So, my question is, if you were continued at the 214 rate for the nursing program only, do you believe you could meet your goals this year?
Yes. So with our master's program, what we did do is we're actually we have four tracks now. We have the global leadership and we have the nursing education, and people still want to do global leadership. We have more pull in global leadership, but nursing education, as you know, we're having a problem with just maintaining faculty as it is. But we now have the mental health nurse practitioner track, and we also have the family nurse practitioner track. And we started the mental health in the summer, and that program is growing rapidly. And then we are starting our family nurse practitioner program this upcoming spring, and we already have candidates for that program. So although our education and global leadership programs haven't given us what we had anticipated, we now have 2 other programs that are doing very, very well. So we anticipate that those programs will get us where we need to go. And then part of that ask is with our simulation, we're really seeing where simulation is having, that's not something we have to wait to see. We know that simulation is having a huge impact on our student being able to better understand the concepts of nursing, which is the critical thinking is a big piece of what's or a big gap for the students. So Ms. Fields is she's a one-stop shop, like she's doing everything. So I think part of that or part of what we would like to do would be to have another person that would be able to assist her in the simulation lab, and then also in our skills lab. So we need another person for that. So that's part of the ask. So yes, I do believe that we'll be able to meet our goals. I do.
I think, and just so you know, I love the ideas and the innovation and the community work that you're trying to do, but our fund is dwindling significantly. And so we really have to try to figure out how to get the biggest bang for our buck.
Understood.
Yeah, and focused on the goals of the program. And obviously, nursing workforce is a huge focus of that and is really important. And so my last question would be, in your application, you mentioned the goal of wanting to have 35% of the state's annual incoming freshmen into your nursing programs, assuming it's all the programs. Do you know what your percentage is now? Because that's not in the application, so I wasn't clear how far you had to go to hit that goal.
I'm not sure right off, but I definitely could get that, information to you because I know that it's important. I'll make a note of that just to get where we are in comparison to where we want to be.
Thank you. Those are my questions. Committee members have questions? I am not seeing any other questions. Thank you both for your time today. We really appreciate the presentation. It was very helpful.
Thank you. Thank you so much. I appreciate being here. Bye-bye.
And Dr. Harp, same thing. You can just turn your camera off if you plan to stay. I don't know if you have an option on your end to go back to the public view, but I don't want to kick anyone out. So Chair Manning, next on our agenda, that was our new applicant discussion, our workforce development discussion. And then we were just going to jump into the remaining application discussions. And we did provide to the committee members a couple different scenarios. Scenario 5 is where we kind of ended up last meeting. Chair Manning, I don't know if you want me to kind of give a rundown or if you have some bullet points or any other committee members, but this is kind of where we get into some more pointed discussions and start making some funding decisions.
So, I mean, I'm fine if we want to start where we left off with that conversation. I just want to be sure we are, that every committee member has had the chance to consider every application on its merits, ask any questions about those, make any comments about those, so that when it comes time to vote, we know where we stand, and, we can be sure that every application has received its due diligence. So if there's an application that somebody has questions on, or that they want to flag for some reason or discuss, let's make sure that gets elevated today in that conversation. But yeah, I'm fine picking up with where we left off with some of those general thoughts that were the consensus of the committee. Sorry.
Oh, that's perfect. Let me just provide a rundown of that really quick. So to summarize where we are in scenario creation, we have 5 scenarios, 3 of which were ones that we were playing around with considering core programs versus non-core programs versus switch funded programs. And we got to scenario 5, which I want to walk through a bit, and then we can jump around to other scenarios and pull pieces of them and just continue our conversation. But where we kind of left off was we were not going to switch funded. Yeah, go ahead, Mr.
One
Bolton.
second. Are you talking about scenario 5 or 3?
I was talking about scenario 5 first, and then we can jump back to those scenarios. Those 3 scenarios are more non-core versus core discussion. However, where we landed up in scenario 5, we didn't have any core non-core discussions in there yet. We could add it in. So if it's easier for me to start with those scenarios, I can do that as well.
No, 5 is where we pretty much ended up
Yeah.
last discussion. So I think that's a fair place to start.
Let me
and I
actually
would just-
share my
Go
screen.
ahead.
I'm going to share my screen to help with the visual. You can keep talking. Let's see. Let me know if you can see that. Can you see the?
Yes, we see it.
Okay.
Yes.
Okay. Let me just make sure. Let me know if it's too small or too large. But scenario 5 is where, like we said, we ended up. So that was not funding switch funded programs, which are these programs listed towards the bottom of the scenario. And we have 3 programs in this category. These programs are defined as programs that were at one time switch funded from the general into HVAC that we've identified back in the past. I think we went back to fiscal year 19. And this has been a consensus not to fund these the last, I don't know how many years these have been suggested to not fund and switch back. We did create a new category for this scenario and all the other scenarios that's reflected in that now based on conversations with this group. And we did label it state operating programs and added DHSS in there just because they are all DHSS programs. Some are not in here. But we can definitely take time to, and I see Senator Poirier, your hand is up, so I'll jump to you. But we have these in this group based on conversations with committee members the last 2 meetings and being able to distinguish between these programs that we've requested DHSS request in their base budget, some sort of their budget process versus the other programs. So we did illustrate those differently. Senator Poirier, we can jump to you now if you'd like to talk about actually, let me get through the scenario real quick and then we'll jump back to you if that's okay. So it was recommended not to fund these. It was recommended to fund Deltec's program at both of them, their nursing program and paramedic program at 80%, which is what we did last year. We recommended. There was an actual vote to not fund the behavioral risk factor surveillance system, which is through DPH. That's in the new program section. And then there was also a recommendation to fund the remaining programs that fit the previous fiscal year's budget, so fiscal year 25. You'll see that reflected. Let's see an example. For example, the innovation fund, we put it back to 1,500, even though the request is for 2,000 this year. Same thing here. You'll see scenario 5 reflects the fiscal year budgets of these programs. And then the final caveat that we landed on was not to entertain any new programs unless there's some sort of surplus after going through the other decisions. So again, these are the new programs. So we went ahead and zeroed all of those out. And again, this one is the one that we took an actual vote on. So I can go back, Senator Poor. You can unmute if you'd like to.
Sure. And being new to the committee, I just have a quick question. If you could just scroll just a little bit down. Sorry, I want you to stick under the DHSS though. I apologize. Okay. So in this group, I'm just curious to know, there's you the respite care, you have the personal attendant service care, you have the assistant prescription assistant program. So all of these, are these already line items in the budget that are being funded? Is this additional dollars?
No.
In some instances, yes. Do we have, let me see. What's that? The past funds are definitely additional funding. The respite services, I'm assuming, also are additional funds. When we can circle back to you with the details on each one, we'd have to look at each application, because they are, some of them might say that, but they might be funding something different within that. So I'd have to go back and look at each one individually.
Okay.
Go ahead. Sorry.
That's okay. So Madam Chair, then if that's the case, and I realize that you have already, this group has already voted to, I guess my question is it going, these additional funds, if they are additional funds, are they going into the budget? So in an increase in numbers, so as an example, respite services for 55,000, is that going in on as a higher number request in your future budget?
So here's the problem. Most of these things were not requested through the budget process for two reasons. One, they're not considered a door opener, so they wouldn't make it in as a door opener. And two, we were not permitted to ask for anything in a 1% request this year. So while the committee's goal is to get what should be operating budget things out of this fund, and they've been loud and consistent about that desire. And we've recommended it. Last year, we recommended a lot of these programs be switch funded, and that request was not granted by OMB. But we've talked to OMB, and essentially their approach is, the agency, we need to figure out how to move these things out, and it could be done incrementally. It could be done, for smaller amounts. It's possible a division could absorb it, but these things have to be. It has to be a collaboration. It can't just be us saying, move all of these things into the operating budget, and OMB is going to say, sure, we'll do that. But the goal here is to focus, to have the divisions focus on where they can get these funds. Can they get them internally? If they can't get these funds, then they need to request them through a budget process. But that wasn't available to us this year because we don't have the 1%. So that's kind of the situation that we're in, is that we have to make these decisions now for this fund because these recommendations are due November 1st. But we're still in the budget process and we won't know what the governor's recommended budget is and whether these things would be funded or not in the recommended budget. So it's a difficult situation to make some of these decisions, but the will of the group essentially is to return this fund to its purpose, and which I understand, and that was not to essentially support the state's operating budget.
Sure.
So that's kind of where we are.
Okay, so I have one last question. Was there supporting documents for, as an example, the respite service, personal attendance service program? Can you say that all the funds were exhausted for these DHSS programs in this past year?
So I'd have to ask the budget analysts for that information because, I could tell you, I can't tell these particular funds, particularly where you have an overlap, right? Were these particular funds exhausted first, or that was the operating line exhausted first? I don't know that. And, was there a surplus at any of these lines? I don't know that.
Sure.
Either. So,
Okay.
I think, to be candid, these are things that have existed in this fund for a long time. And they've just kind of rolled over, and everybody probably got accustomed to that happening. And now this committee is saying, that's not what this is for. Let's figure out how to change that. And so it's really the conversation is new, even with the divisions, because I think, they had the expectation that they would get these funds, and, we'll have to figure out what they're going to do if they are not awarded these funds and they don't show up in the GRB.
Sure, absolutely. And just, again, speaking on what I know, and we just heard from Dell State, we have a shortage of folks that are entering into the healthcare field. So you do have, if these are support dollars for families that are already taking care of their loved ones versus putting them in a nursing home or putting them into some type of assisted living, that is still ultimately going to cost the state even more money. It's just something that needs to be considered. I just wanted to make sure that I asked these questions, considering that these funds have been noted, they have been paid in the past, and should they not make it back into the budget, then how many families, and we could go down the list of all of this, of course, but how many families will be subjected to having to make other critical decisions that could ultimately lead to more cost in the state versus a cost savings. So thank you, Madam Chair. I appreciate the answers, and any follow-up information you could share would be grateful.
So for one, as an example, I looked at the Triple DS respite services application, and they say that their health fund contribution is 10% of the total funding that they spent in FY24. So, from that perspective, yes, they would have exhausted those funds. But we would have to go back and look at each application individually to know what they spent of it and how they spent it. I think, but you raise a good point, and the committee did not officially vote, just so it's clear on what to do. There was a discussion and some consensus, but we have not officially voted. So it may be that from that perspective, if we want to go through all of those line by line, I will do whatever the pleasure of the committee is. Obviously, I have to abstain from all of these. So it's the pleasure of the committee if you want to do that. If maybe that, or if you want to wait until we get additional background information about, are these part of a larger pot? Can the division absorb that pot? I can probably predict what they will all say. But I will do what the pleasure of the committee would like to do.
Sure. Madam Chair, if I could just ask one last question, and I apologize that I'm belaboring on this, but Under those on line 60 and 61 and 62, just out of curiosity, are they pass-throughs to the MCOs? Is it a part of their contract that they sign with the state that they provide these services? And if you would,
I don't believe so, but I'm going to have to double check on that for you.
no problem. Could I just indulge the committee for just one more minute in regards to this?
Of course.
So if it is a pass-through and not an addition, our MCOs sign a contract with the state of Delaware. They are given a certain amount of money that they have to allocate per the amount of people that would fall under the Medicaid in order to receive some of these services. So picture this. If you are someone that is homebound, but only homebound because you need supports to get out of your bed and to begin your day, if your person does not show up, whoever's scheduled, whether it's through an agency, whether it's a personal care attendant, whatever that may be, those hours pass. Somewhere along the line, the dollars are sitting somewhere because they haven't been executed, because there hasn't been a payout somewhere along the line. So this is some of the questions and the reasons why I'm asking this. If they've been exhausted, fantastic. And we can certainly further the conversation in this, but I just want to put this out there to the committee. Somewhere along the line, if the hours that are committed to a person that needs the additional help and someone doesn't show up, then where does the money go?
So I think just to speak on that, I can speak on that a little bit. The reality is we have to fund it as it will be used. And then the contracts with the MCO, as far as what they pay, obviously they contract for that, what they pay. If somebody doesn't receive that service, then they don't have to pay that. Then yes, they're still getting their contracted funding from us, but we can't, there's no real way to negotiate the contracts in a way that we could scoop back, an unused personal assistant service hour, right? I mean, there's no way we could do that. So that's built into those negotiations, which are taking place right now, I believe. I think that is a little separate from funding what we need to fund to provide the service. So, but we can get more information on how that's constructed. I do have budget folks on the line. If anybody has an answer they'd like to share, information they'd like to share, please feel free to jump in. But we will circle back to Drew and figure out, exactly how these funds translate into the consumer directly, and we'll get you that answer.
That's awesome. That's exactly what I'm looking for. So I appreciate that. Thank you.
May I jump in at this point? And Senator Poore, welcome. And I think you know my sort of number hungry kind of perspective on things. It is my experience on the committee here for 2 years, 3 years, is not that we want any of those expenditures to not occur. We don't want them to come from this fund. We've had state operating obligations pushed over into this fund around 2009 during the financial meltdown. And right now we have about $13 million of those expenditures requested of us because of history, not because that's what this fund was for. And our reserves have gone from around 50 million to around 11 million. And if we do not say stop, then we are going to hit zero. And not only will we not be able to pay for these state obligations, we won't be able to pay for the cancer reduction and the tobacco reduction that this fund was established for. So that's why we said last year, no, stop it. And they said, thanks for your input and did nothing. Understandable, because they had to find the dollars, and it's a zero sum game in there. We talked a bunch at the last meeting, And one of the scenarios is a not bring it to zero, but bring it to 60% to say to JFC, OMB, et cetera, it needs to phase to zero. It's got to get down to zero. And going to zero all of a sudden, just slamming on the brakes is probably not practical. But these dollars within 2 years, if we change nothing, if we leave it at what they're requesting, we have zero reserves in 18 months. And we won't be able to fund the programs which this is designed for. And helping the state out during 2009, sure, it's great then. Having done that for the past 15 years is not appropriate. And it's past time to say, we got to bring it down. Let's jointly figure out a path to get that out of here. So I just want to give that extra background. And it's not that we want any of these programs to have the requested spending to not be done, because as you point out, this is life-changing and life-saving stuff. But this is not the place to be paying for that. That is what the general budget is for those incredible services that you identified and the other ones that we're recommending be cut or eliminated from this fund only. Does that make sense?
Yes, thank you, Representative. I don't want to speak for OMB, but what you said about, doing this as a percentage or doing this, I think that would be a preference for them as well. Like, let's figure out a way to slowly, not necessarily slowly, but to transition it over that is not some blunt instrument that's going to drop $13 million into the state budget all of a sudden. So I think if we can do that, then that would be the best approach. But okay.
May I just add one more thing? Thank you, Secretary Manning. I have emailed to Representative Williams, the co-chair of Joint Finance. I think she's reached out to the Controller General just to make sure they're aware of this. I'm not sure if it makes it, I imagine it has made it through from OMB to JFC and Controller General's office, but to make sure this comes up. DHSS has a full day in front of the JFC on November 15th. I'd like the committee to consider requesting our chair to request a few minutes to present this issue of we must get this out of the health fund. And we'd love to work with you to get that done at a pace that both is achievable and from our perspective, as in doesn't bankrupt this fund and is done at a pace that the JFC can find a way to accept.
I have not received the guidance yet from them as to what our public presentation is to be. But certainly this is a part of this department's budget consideration, because if it's not funded here, the department's going to have to figure it out or include it in any discretionary asks that they're permitted to do in future years. So I have no issue incorporating it. I just don't know what the instructions are quite yet.
Thank you.
Mm-hmm. So in the interest of trying to get to our destination, it does seem like this chunk, the state operating program, particular to DHSS, are contentious, to say. That gives it a negative connotation, but they're up for debate of how we should handle that. So, again, I obviously have to abstain from all these. So I really need the group's direction here of what your preference is and how you would like to handle this particular group of items.
My preference is to not have this be a line item by line item of these state operating parts, and instead to say, these are operating, this is not our responsibility. However, we know you can't get from where we are in fiscal 25 to that in fiscal 26. But say, we want these funded at zero, and we will recommend that you commandeer 4 million of our reserve to help you transition to that. But these should not be funded. I mean, what they've been doing is taken, 8, 9, 10 million a year from our reserve. Let's just call it what it is. They're taking money from the reserve. So say, we know you need to do this to transition all these into your operating. We'll help you with that. But this is not a line by line decision. These are operating costs for DHSS that should not be paid out of this health fund. We know we can't get there immediately. Let's just get how many dollars and have the decision not, oh, well, we can't get it to zero. Well, okay, fine. Just admit you need dollars from us to balance your budget. You took 8, 9, 10 million last year. Let's have that be a little bit less and just say, fine, we'll give you 4 million from our reserve. But stop this having us pay their operating out of our fund.
Representative, do you have a motion?
I will move that we not fund the DHSS state operating programs at any level in our recommendations, and that we recommend that $4 million from the reserve be released to the state budget process to help with the transition to getting those programs fully into the state operating budget for fiscal 26.
Thank you.
Representative Bombeck, are you suggesting, is that including both the state operating programs and the switch funded programs jointly?
As stated, it's just the operating, but I think that is, I'd like a brief discussion of, is it a distinction without a difference, or are the two really the same category?
Well, we've defined them differently for discussion purposes. Essentially, they're the same. But I think we should probably, in our recommendation, keep them separate. Because they have some historical differences. I'll put it that way.
Yeah. Jules, can you remind us what lines the switch funded stuff, is that spread throughout as opposed to you've combined the operating stuff in one area?
Yeah, so many of you have been members a couple years, but for many of you this is new, but we have this switch funded programs grouping that I've dated back to fiscal year 18, I want to say, that have been the same programs, and I believe we started with 17 there, and they've slowly dwindled and only these 3 are left. As far as the other programs that we've labeled as DHSS state operating programs, these were identified differently than that switch historically. Rather, these are programs that came about that somehow ended up in HVAC over the years. I apologize that we really had a hard time going back to HVAC's been around 20, 25 years to follow the narrative of a lot of programs. But these ones weren't identified in that switch funded group in the historical look back. But however, like you said, almost very similar in the fact that they shouldn't be funded through HVAC. However, these were identified to specifically ask to move to the DPH operating budget request. And Secretary, if you could potentially correct me on some of that at the end. These were just ones that were more intentional about switching over.
Yes, I think that the operating budget were ones that in the group's discussion seemed more directly aligned with DHSS operations, whereas the switch funded programs, the nursing program, the Cancer Council, the Nurse Family Partnership, while they run through DHSS, they seemed less operational. And I think that was the distinction that was made.
Yeah.
They were more community-based programming and things like that, but the others were more internal operations. So Representative, your motion is currently on the table regarding the DHSS state operating programs. Did you want to leave that as is, or did you want to end that?
I think I'd rather have it be two different motions and discussions and decisions. So I'd leave it as is, as let just talk about zero in the state operating and the 4 million earmark of the reserves to help the state transition.
Okay. And is there a second for that motion?
I'll second it. This is Don Fulton. I'll second it for purposes of discussion, but I do have a question, and it probably is directed toward the members of the General Assembly that are on the committee. Would it be easier, instead of saying our intent is to get all of these out of the health fund advisory fund and into the general fund, and we will give you $4 million to help in that process? Or would it be easier to say, for fiscal year 26, we will fund them at 60% with the intent that will go to 40, 20, and 0 over the next 4 years, or something to that effect?
Don, my fear and expectation is that, first thing is, my expectation is the GFC, because of its mandate, is really focusing on fiscal 26. And that's the first thing. The second thing is, as we saw last year, our recommendations can get disregarded to us pretty easily by the powers above us. But I think I worry that a JFC member can say, hey, you're just cutting to zero this program. We can't do that. And we don't have the dollars for that, without really saying, what are the ramifications of that? By them overriding us, they're like, hey, we get to restore this stuff. And they miss, I worry, they miss the real impact is our reserve is going to zero, and we are going to have to gut our core programs because of that. So that's why I want that focus. And I think it's good to say, and we'd like to keep working with you to get it there. I worry after last year that, we say 4 and they may end up saying, well, we'll take 6. And frankly, anything to have them acknowledge what their actions, and I don't mean just JFC, if it's only OMB, if it's only JFC, whatever. But I think the admission that they are completely consuming, the actions are completely consuming the reserve is what needs to be focused on. And I think I like our recommendations to clearly offer an olive branch and a path to get that achievable transition to reassume these operating programs within the operating budget.
And in terms of the discussion that's going to occur in the General Assembly, it's easier to say we have 4 million, a dollar amount, than it is a percentage.
I think the percentage hides the impact of the depleting the reserve.
Okay, gotcha.
So we have the motion and we have the second. Is there any further discussion?
Once again, this is on the
DHSS operating, that they would not be funded, and that there would be $4 million out of the reserve set aside to assist with transitioning these programs back to the state operating budgets.
And you can sort of say that we'd be funding the DHSS operating at 45%. That's what the 4 million out of the 7.4 million requested, or something like that.
Okay. Any further discussion? Jules, you want to call the vote?
Yep. Sounds good. I'm going to run through. Representative Bolden is absent. Senator Richardson,
No.
Mr. Fulton,
yes.
Miss Massa,
Abstain.
Representative Bomback,
Yes.
Chair Manning,
Same.
Mr. Patel,
Yes.
Dr. Silver,
Abstain.
Ms. Tuxford, let's see. Looks like is that her? Nope, looks like she's absent. Probably just had to jump through. Dr. Lee
Yes.
and Senator Poor.
No.
Let me just tally up. We have 2 noes, 4 yeses, and 1, 2, 3, 4 abstaining. So, Chair, I'm unsure the amount. I don't think that is more than. I'm unsure the process to what number we have to get to. I'm assuming
Okay.
more than half.
Yeah.
So, all right. So motion fails on that.
Okay. Does the group have other suggestions as how they want to deal with this group?
I might suggest that the 2 no's provide us some insight on your vote, and if you have a suggestion on how we might navigate moving forward. I mean, we can do exactly what we did last year and just say, we're not going to fund it. And then General Assembly comes back and says, yes, you are. And we're in the same exact spot as we are right now, with no resolution for the future.
Sure. If you could kindly tell me who was just speaking.
Don Fulton, I'm sorry.
Oh, okay, Don. I'd be happy to share why I'm a no. So being a new member to the committee and then reading what the Health Fund Advisory Committee menu means, while I went down the points as everybody was voting and realizing that the tobacco fund is what is establishing or participating in this, it does relate to some of the things that are listed in this particular state operating program under DHSS. So we're talking about promoting a payment assistance program for Delaware citizens who suffer from, now it does say debilitating chronic illness. And then it goes on to say such as diabetes, kidney disease, and characterized by reoccurring costs for equipment, tests, therapies. Such other expenditures as are deemed necessary in the best interest of the citizens of Delaware, provided they shall be made for healthy related purposes. So does that answer your question of why I'm a no? Because unless you can, I'm asking some general questions. And if we know that this is already in the budget or it's in the MCO contract, and this doesn't turn around and become a larger cost to the state of Delaware, you have families coming out of, and from line 60 to 61, and then down to the, I apologize, I'm old and trying to see the small print, down to the prescription piece of this, and I can't figure out which line that is. Thank you, Jules. Oh, wow. Down to line 64. At the end of the day, if after COVID, families are stretched beyond stretched when it comes to caring for their loved ones, which there are people across the state all day long that are doing this. They have made different decisions, life changes in order to be able to take care of their loved one. They're getting burned out because there's not enough supports out there. So if you're saying that the MCOs are going to be able to handle that in the budget, it's going to be able to handle this for the families, then okay, great. But if not, you're going to turn around and we're going to find families that are not going to be able to sustain what they're sustaining today. So I'm happy to have a discussion at another time if we can get some more information on this particular area. And I understand what you're saying, that we're using the reserves. But based under what this is saying under the About the Health Fund Advisory Committee menu,
So personally, there was a moment of silence there, so I'll
Jump right
try
in.
to fill it. From a personal standpoint, these programs are absolutely essential. And in no way am I, or I think anyone else, suggesting that they're not. The point being is a dwindling source of revenue, and the general feeling that these should be funded, but funded out of the general fund as opposed to out of the health fund monies. So I please understand from my perspective that these are absolutely essential programs that should be provided for Delawareans who need them, and I'm just suggesting that these monies should come from the general fund as opposed from the health fund.
I guess I could chime in now, Senator Richardson. Yeah, I'm concerned that some of the programs on this list really don't. I mean, I think it's a stretch to say that they should be receiving these funds. If the funds want to come out of the general funds for the state of Delaware, that's different. But if we want to narrow the focus to what is the funds were intended for, I would like to see that happen before any approvals granted.
Oh, yeah, I'm sorry,
Yeah.
Senator Richardson. I'm not understanding. So I can't recall at this point, but I think you were one of the no votes.
Yes.
So just so we're all, I just want to be clear on your position. It's, you don't want to have these not recommended for funding, which was the vote, but
Yeah,
you don't want them,
Yeah.
you're just not want it as a group. I'm sorry. I just want to be clear.
Yeah, I just think that we need to be more careful about how these funds are allocated, and so that their original purpose of having the funds is paramount. That some of the programs on here, if they're good programs, and I hear that they are good programs, maybe shouldn't be coming out of this fund, but coming out of the general fund instead. So if we just go ahead and say that we're going to approve all of these, I don't know if we're fulfilling our obligation for proper use of these funds or not.
Right. So the motion was not to approve them. The motion was to have them switch to the general fund.
Okay, so you're saying all of these go to
Yes,
the general fund.
correct. The motion was to have all of these,
The ones labeled as,
so the ones labeled as DHSS operating programs to not be recommended for funding by the health fund. And the concession as part of that motion was that we would allow up to 4 million of the reserve funds to be used to transition those programs out of this fund, so that by FY27 there would be zero of these.
So you're still using these funds, but
4
you're
million,
reducing
yes.
4 million.
the amount to 4 million.
Correct.
All right, what was the original amount? I don't see that on here.
7.3 million, I think.
It's, I was going to say 7.6.
Okay.
If you'd like to make a different motion, you're welcome to. The other one was defeated.
So it sounds like he approved.
Oh, that sounds better. I understand it better anyway.
And one thing to point out, from looking at the health fund summary, the requested funds was I'm sorry, shoot. It was 33,800,000, which is and that includes the reserve. It would bring the reserve from 12.3 million down to 2.3 million. So if all we do is what we already voted on to get rid of the behavioral risk health surveillance systems, then we are agreeing to cut the reserve by 85%. So I would hope that is not where the committee is moving towards.
And maybe this is something that I think this group has tried to avoid in the past. I know that previously you would vote on scenarios, you would vote on programs in clumps, but it sounds like there's enough differences of opinion and strong feelings about some things. Is there a thought to perhaps just going through program by program and making these decisions and not trying to lump them together? Is that something that would help facilitate this better? That's just a suggestion, not a demand.
How many programs are we talking about?
I don't know the count off the top of my head.
Joel,
70 or 80. Dr. Lee has her hand up.
My only concern is that voting line by line, unless we have a strict criteria, lends itself to bias. And so we would need firm criteria that we're using to evaluate the programs.
But I don't think our evaluation of the application or program changes regardless of which way we do it. Does it? I mean, we all are expected to have read all of these applications, to have, understood the funding streams to the extent that folks have other avenues of funding. Some of these folks have opportunities for grant and aid, others don't. And to vote on them, whether we do it as a group or whether we do it individually, I'm not sure that obligation changes.
It does without firm criteria. We know that without firm criteria, our personal biases are more likely to be taken into account when we're voting. So unless we're saying, let's use strict criteria, only programs that are directly related to cancer prevention, I would agree with that. But going by line saying this organization is deserving and this isn't, opens itself and lends itself to more biases. And I would not approve of that process.
Okay, other thoughts? I will say, Dr. Lee, you tap into something that I want to raise later in this conversation, which is I'd really love to get this process cleaned up more, and I would really love to have it in a better place. My timeline is very short, but I think that this group should not just be meeting a few times a year to do this. I think there needs to be a creation of some kind of scoring document and some criteria that is specific so that it is easier for the members of this committee to make these kinds of decisions. And I would like us to be able to at least start that work because I think our job each year is probably really hard for some of the reasons that you touched on, Dr. Lee, and the volume of applications we get and sometimes the lack of information that we get from the applicants. So I think cleaning up the application, creating not tougher criteria necessarily, but more specific criteria for us to consider and weigh, although it can't be, and I know Representative Bomback, you mentioned this at our last meeting, having sort of a scorecard like you do with an RFP, a little challenging because these are all different programs. So it's comparing apples, oranges, and bananas instead of, just apples to apples. But I think we could come up with something that was usable and helpful to facilitate this better. How y'all have done this all this time without it is mind-boggling to me, but we definitely need, I think, to try and do that going forward. But for where we are right now, we have to figure out how we're going to move this forward. So I'm open to ideas and suggestions. If you would like to do it how you've done it in years past, I'm willing to do that, obviously, which is the groupings and, sort of voting on them in by scenarios that have been presented. I can let Jules tee up the scenarios again, and we can do it that way. What's the pleasure of the group?
I have sympathy for Senator Poor. I know, she said she's rather new on this council. So even though I've been on the council longer than she has, I'm also on 10 or 11 other committees or councils or consortiums. So, the amount of time that I can devote to either one of these is very limited. But what I would suggest is, if we have 80 different programs, is there any way to rate these programs as to how which ones more closely qualify for this funding? Is that a possibility? Could we take the top 10, the top 20, the top 30, or whatever? The ones that
So I think we have them.
These funds were intended for.
Right. So we have the groups of the cancer programs, the tobacco prevention and control programs groupings. Those are the most closely tied. But as Senator Poor, pointed out, the criteria for the fund does include programs that have other health benefits, health-related benefits. It's not strictly tied to tobacco and cancer. However, certainly cancer and tobacco are the closest tie to the purpose of the fund. And those are blocked out in the scenarios. Jules, do you want to, just for the group, perhaps, if the pleasure is to start with those, we can start with those. If that maybe gets us some progress. Do you want to talk about what's in the cancer programs and just review that for the group, Jules, and then we can maybe go block by block on those?
Yeah, absolutely. So, historically, this team has identified the cancer programs and the tobacco prevention and control programs grouping as most tied to HVAC funds. In the past, we have voted on these as groups, and there hasn't been, at least in the past 5 or 6 years that I've been, much hesitation around funding these programs at full. With that being said, I believe these groupings with this scenario, they were suggested funding at their fiscal year 25 budget amount. However, based on conversations last week or 2 weeks ago and the meeting before, I know it was also brought up funding core versus non-core programs. So we can also see these at different levels as well. However, I will say historically, these have been funded at 100%. I can entertain any questions specific to these applications that we can dive into. However, in the past, we have just voted on these in groups and there hasn't been much discussion.
I have no problem with that grouping.
But Senator, do you have a motion? Sorry, go ahead, Representative.
I'll move that for the cancer programs grouping, we fund that at 100% of fiscal 25 budget level.
I second that.
Awesome. So at fiscal year 25 funding level, that was Representative Bombach, seconded by Mr. Patel. And I'm going to run through voting for that as a group. So let me run through my list. Representative Bolden is absent still. Senator Richardson,
Yes.
Mr. Fulton,
Yes.
thank you. Ms. Massa,
Yes.
Representative Bombach,
Yes.
Chair Manning,
Yes.
Mr. Patel,
Yes.
Dr. Silver,
Yes.
Ms. Tuxford, believe Ms. Tuxford might be on a call still. Dr. Lee,
Yes.
thank you, and Senator Poor.
Yes.
Awesome, thank you. That I have a record of vote for 2 absent and 9 yeses, so that motion carries. Chair. And thank you, Curry, for putting that in. So that would be scenario 5. It would come in 9.6, it looks like, funded at fiscal year 25 budget. Awesome. Do we want to do the same thing for tobacco prevention and
Jules?
control program?
Yeah, can I
Sorry.
suggest that we do the groups that are marked as core and then come back to the ones that are marked as non-core?
Absolutely. Unless other committee members have objections to that, we can definitely do that. Perfect. Okay, so thank you, Curry. We're at the tobacco prevention and control programs. There are 4 different programs in this section, similar to the first section we just voted on, the cancer programs. We haven't had objection in the past. So is there any pleasure from the committee?
I'll move that we fund the tobacco prevention and control program applicants at fiscal 2025 budget levels.
I second that.
Second.
I'm unsure who got that second in.
Mr. Patel, I believe.
Thank you. So I have Brett Bomback recommending that we fund the tobacco prevention and control programs group at fiscal year 25 budget level. That was motioned by Brett Bomback, seconded by Mr. Patel, and I'm going to go through attendance. Brett Bolden is absent. Senator Richardson,
Yes.
Mr. Fulton,
Yes.
Ms. Massa,
Yes.
Representative Bomback,
Yes.
Chair Manning,
I'm abstaining due to the program within public health that's receiving this funding.
thank you. Mr. Patel,
Yes. Yes.
thank you. Dr. Silver,
Yes.
Dr. Tuxford, she's still absent. Dr. Lee,
Yes.
and Senator Poor. Senator Poor, was that a yes? For some reason I am not.
Yes, it was.
Yes, thank you. Okay, so I have a total for that. I have 2 absent, 1 abstaining, and 8 yeses. So that motion carries as well. Thank you, Curry. So we're finished up with that. Curry, yes. So non-core, we have a core down here. So this program was identified as a core program. This as linking back to tobacco and cancer related. So this is a UD, Center for Drug and Health Studies, Delaware School Survey. Do you have any thoughts about this program? Again, it was identified as a core program. And just to summarize, it was identified as a core program based on previous conversations as a committee. Any thoughts on funding level?
I'm sorry, Jules, what's the program again?
Sorry, this is the Center for Drug and Health Studies. It's a UD program for the Delaware School Survey. I believe it's I believe it's the study they do in schools of tobacco use. I need to pull their application.
Yeah, they measure smoking and vaping and frequency and tobacco, marijuana, all that stuff.
Thank you, Representative.
I'll move that we fund the behavioral health programs, the one program at 100% of the fiscal 25 budget level.
And I second that.
All right. So there was a motion by Representative Bomback, seconded by Mr. Patel to fund the behavioral health program, which is the Delaware School Survey Program, at 100% its fiscal year 25 budget request. So I'm going to again run through voting for this. Representative Bolden is absent. Senator Richardson,
No.
Mr. Fulton,
Yes.
Miss Massa,
Yes.
Representative Bomback,
Yes.
Chair Manning,
I'm abstaining due to the public health collaboration on this grant.
thank you. Mr. Patel,
Yes, Jules.
Dr. Silver,
Yes.
Miss Tuxford, absent, Dr. Lee,
Yes.
and Senator Poor.
Yes.
So that brings us to 7 yeses, 1 no, 2 absent, and 1 abstain. So that motion also carries to fund them at their fiscal year 25 amount. Let's see.
Jules, now before we go to the additional motions, is there a way to track what is the balance and where we stand financially after spending this?
Yeah, so Curry, who is on our budget team, is working the scenario live time on that. Number 5, however, we do have the summary sheet in those Excels that all of you received that is a quick shot of the total. So you'll see here our team pulled it up. It shows what's in the reserve balance, what the projected payment is, the projected interest in the funds available totaled up. And it gives you a live update of scenario 5 as we're working on it. So right now it's about 20.1. And that's with what we just voted on currently. And that at the end, you'll see that there is a 15.6 balance in there. So that's a quick summary. But then also, if you look in the scenarios, each subsection is totaled as well.
Thank you.
Jules, that 20.1, we only voted on cancer programs at 9.6, tobacco prevention at 4.6, behavioral health at 18,000. That comes to just over 14 million, not 20 million.
Yeah.
Okay, so looks like we have to get our template. Appreciate the patience. Just getting these totals added up.
Jules, we really appreciate you and your team's hard work on this.
Absolutely, and I have to give credit to our budget team. This is a completely different language to me, so I asked them a lot of elementary level questions on these numbers. So very appreciative for Curry running the show right now. And thank
Roughly
you for
14.3.
14.3. All right, so it looks like we didn't zero out others. What other ones did we do? So you're looking to see what we've spent so far, is that correct?
Correct.
Okay, so yeah. All right, Curry's gonna zero those out real quick so that we can go through. And I think the only one Curry to keep in would be we didn't take a formal vote, I don't think, but the nursing program, paramedic program. I guess we'll just make our way down. Okay, so Curry, if you can go back to that summary page, see, there we go. Okay, so that's how much we've spent so far. All right. Cool. Okay. Thank you, Curry. So let's go back up and find our next core. Let's see. We have the asthma. Yeah, it looks like, yep. Asthma Project, American Lung Association of Mid-Atlantic. That's in the category health-related programs. Do we have any thoughts or considerations there in funding? And this was considered core based on its association with the American Lung Association in general and their focus on tobacco prevention, cancer prevention.
Jules, this is Don Fulton. I'd like to recommend that we take the 4 programs that are included in the health-related program area and approve them at the 2025 budget requested level.
Okay.
Second.
Seconded.
Okay, so I have Mr. Fulton and then Rep. Baumbach on the motion to fund the health-related programs at their 100% fiscal year 25 budget.
I want to bring up the fact,
Oh, Dr. Lee, I think you muted yourself.
yes, a point of clarification. There are significant differences in the budget for one of the line items. The last line item, I wanted to bring the group's attention to that.
Yes, so thank you for bringing that up, Dr. Lee. Are you talking about AIDS Delaware specifically on that one?
Yes.
Yeah, so from my understanding, they didn't put in a request, I believe, for, here you go back on older. So it looks like last year they didn't get any funds because I don't think we recommended. So it looks like they didn't receive funding. And then this year they jumped to $50,000 request from the fiscal year of 24 was 15. So that's about 35,000 more.
I couldn't remember if they didn't apply or if we didn't approve them.
Let me go back and look real quick. I have a feeling that they missed one year, but I need to confirm if it was last year. Let me pull that up really quick. Okay. Let's see. In fiscal year 24. Okay, in fiscal year 24, they requested 15. Scenario A, we recommended 15. But, Cree, is it okay if I share my screen real quick? Just to make this a little easier. I'm going to replace your share if that's okay. So let's see. Okay, so it looks like in the fiscal year 24 report, they went fiscal year 22, 8, 9, 9, 15 requests, and we recommended that funding level. Let's look at last year's report. Last year's report, it looks like I think it might have been last year that we didn't receive an application from them. Yeah, I think that's what it was. Last year we didn't, because we removed them from this document. We should have kept them to portray that they didn't request funding. So yes, I think last year they either missed the application or didn't put the application in. I'm going to stop sharing and send it back to Curry.
Don, would you consider having AIDS Delaware brought in at the fiscal 24 level, 15,000?
Yes.
You would make that a friendly amendment or whatever procedurally you want to do it?
Okay, so to confirm, I have a motion by Mr. Fulton and seconded by Rep. Baumbach to fund the health-related programs at fiscal year 25 budget amount, except for AIDS Delaware, that would be funded at fiscal year 24 budget. Correct?
Agreed.
Awesome. Thank you. And we will make sure to portray it correctly. And then AIDS at 15. So I'm going to go ahead and take a
Are we ready for discussion now?
Definitely welcome discussion. Or Secretary, do
Yeah.
we have to entertain the vote or can we have discussion still?
Oh, no, you can still have discussion before the vote.
Yeah.
Okay. Originally, you're going to talk about voting on the asthma project, which I'm very much in favor of. I'm not in favor of the other three being included in that. So regrettably, I'm going to have to vote
Vote
against
no.
this.
Okay.
Was there any other commentary about any of the other programs that anybody wanted to weigh in on, share before the motion on the floor is voted on? The only thing I will say, and this might be controversial, but I'll say it anyway. Delaware Hospice is an incredible, wonderful program. I've had family members benefit from it. It's incredible, truly. They have lots of other payers, and I don't know that the end of life care that is provided, I don't know that that's as close of a tie to the health fund criteria. Yeah, I see that it is. I mean, I'm not trying to take money from anybody, but I'm just putting that out there. That was my only thought on any of the four that are listed.
Madam Chair, if I could just ask this question. Under the Delaware Hospice, is that based on actual sites, or is it basically related to hospice care in the home?
So their application was for it was broadly for their all of their locations: Delaware Transitions, Delaware Palliative, Delaware Hospice Center, Hospice Center St. Francis, serving 6,873 patients and families statewide. So it was pretty broad. And my comment was really that they have other payers. They get Medicaid, they get Medicare, there's a lot of their services are covered by their payers. Plus, obviously, they receive donations and other funding. But that was the only one of those four that I had commentary on.
Okay, thank you.
Mm-hmm. Does anybody else have any commentary or questions?
Yes, in regards to your current comment, and I need to pull up the application, are they utilizing these funds specifically for any particular initiatives or group of participants? And I can open it to read into it myself.
It looks like it's primarily salaries and facility costs, mainly salaries. That's what I guess that's what they're pointing out their organizational budget is.
And did you see any shortfalls or anything why they say that these funds are particularly of need?
Nothing that stood out to me. I don't know if anybody else saw anything.
I think there's a mention of them opening an additional 8-bed unit, and presumably having greater HR, salary needs with that.
Yeah, I was looking for if you do not receive health fund services, what would you do? They receive partial reimbursement from Medicare, Medicaid, private insurance. We seek grants, donations, community support, with decreased donation income, just being able to break even. Without the health fund, we would most likely need to reduce the number of Delaware Transitions clients served, and possibly the number of hospice and palliative care patients who come to us without insurance. So that's insightful.
Yeah, on page 11, they note that they cover 446,000 of uninsured costs, and the funds from the health fund help them offset part of those costs.
Okay. Yes, refreshing my recollection of that actually alleviates my concerns if they are using this for uninsured. Okay, so there's a motion on the table There's no other hands raised for discussion. There was a motion and a second.
Yeah, I can repeat that, Chair. So there's a motion, a second by Mr. Fulton and Rep. Bomback to fund the health-related programs at fiscal year 25 amount, except for AIDS Delaware, that would be funded at fiscal year 24 amount. So we're going to go take a vote on that now. Rep. Bolden, absent. Senator Richardson,
No.
Mr. Fulton,
Yes.
Ms. Massa,
Yes.
Representative Bomback,
Yes.
Chair Manning,
Yes.
Mr. Patel,
Yes.
Dr. Silver,
Yes.
Ms. Tuxford,
Yes.
Dr. Lee.
Abstain in my affiliation with one of the organizations.
Thank you. Senator Poor.
Yes.
Thank you. So that's one absent, one abstaining, one no, 8 yeses. So that motion carries. So thank you, Kari, I think. Yep, you updated those. Perfect. All right. Do we have any other core programs? I think the rest were non-core. Okay. Let's switch on all those. Okay, so we're gonna start back up at the top if that's okay with everyone. And start going down through our non-core programs. Jump in if you have somewhere else you'd like to start. So we have Delaware Network for Excellence in Autism. It's in our disabilities program group. This is a UD program. And committee members should have received a couple letters of support from a few agencies that were trying to support the funding of this program. So I just want to make sure committee members did get copies of those, and it'll be recorded in public comment as well. But I open the floor. Any conversations, any thoughts on funding level for this program?
Jules, this is Don Fulton. This is a fabulous program. I'd like to endorse it and recommend that we approve it at 100% of the 25 funding level.
There's second. All right. So
Can I, Don, would you mind, obviously, you've been on this for a while. Why is 100% not 90, 80 or something else? Can you just help us understand?
Only because I know personally the program and the impact it's had in Delaware. And obviously it's not a core program, but it does amazing things. And this is a small part of their funding, but a critical piece of it. And I just think it's a great program. And the tobacco settlement master agreement doesn't allow us to support health-related issues. And this is one area that I think is really important for a variety of reasons.
Jules, where is this in the applications? I don't see it under Delaware Network or DNEA.
would it be under the University of Delaware?
Oh, that could well be. Disability studies?
Yes, I think so. And I think Sarah Mallory is there with UD. I believe it would be through that. It is the center, I believe.
Yeah, yep. Okay, very good. Thank you.
Yep.
And yes, she is present in person if there are any questions.
Okay, so we do have a motion currently. Motion by Mr. Fulton, seconded by Mr. Patel to fund the disabilities program, which is the Delaware Network for Excellence in Autism, at 100% fiscal year 25 request. Was that correct, Mr. Fulton? I apologize. I missed if you said fiscal year 25 or 26.
25.
25. Thank you. All right.
It actually is the same, but
Yeah, it is the same. I just want to make sure on paper I have it at the right. All right, I'm gonna run through attendance again. All right, so Representative
Is there any
Bolden.
discussion?
Okay.
Hold on, Jules. Was
Sorry.
there any discussion on the motion?
This is Marshall. I will say I'm having problems raising my hand. For most of the organizations, especially those that aren't directly tied to the tobacco settlement, we have proposed that there be a reduction in the amount that they are requesting for fiscal year 26. And so this would be, we have treated this application a bit of like an anomaly, even though they haven't requested increases in the past. So I want to bring that to attention of our group to see, is this an opportunity that we may want to propose a reduction that is in alignment with some of the other applications that we approved today, or if we feel comfortable funding them for 100% of their requests.
Madam Chair, could I just add a comment?
Please.
Okay, Dr. Lee, I just agreeing with your earlier comment, and to Don, it is a great program. But we are getting to picking what moves us most versus what the actual intent is. So personally, I would never vote against this particular item, but it does lead us back to picking what moves us, what motivates us, versus having set guidelines to how to do it, how to actually vote on some of these things. I just wanted to make that comment.
Just so we can, this is the first non-core isolated project. I'll throw an amendment out and see what the comfort with the committee is. I offer an amendment to have it be funded at 80% of the fiscal 25 budget level.
Second.
Okay, there was a motion and a second. Is there any discussion about funding this at 80% of the FY 25 funding level?
I think we just need to make cuts. And obviously we prioritize the core stuff. And I really love Dr. Lee's point of it really shouldn't be a program by program, but rather a more subjective than objective way. And I just think we have to prioritize the core and keeping the funding there for the core. So that's the genesis of the amendment.
Thank you. I appreciate that explanation. Any other comments? There was a motion and a second. Jules, do you want to call it?
Yes, Chairman, I just want to make sure we're good because we had one motion and a second that wasn't voted on, and then this was offered as an amendment. I don't know the formal process to nix the original one. It's just this is
this is additive. So we get the amendment whether it fails or passes, and
Okay.
then vote on the motion whether it has an amendment or not.
okay. All right, sounds good. So
I didn't mean to jump in, Madam Secretary.
No, not at all. I was actually going to short circuit it a little bit and just ask if the initial movement, who at this point I don't recall who it was, wanted to withdraw their motion in lieu of the amendment.
I made the original motion. I'll withdraw it as and accept Representative Bombeck's as a friendly motion.
Excellent. And I believe Dr. Lee was the second on that.
This is Autumn Tuxford.
Oh, sorry about that.
It's okay.
thank
All right,
you.
so then we are in good order.
Awesome. Thank you. I have Representative Baumback with a motion to fund the disabilities program at 80% its fiscal year 25 amount, and this was seconded by Ms. Tuxford. So I'm going to run through a vote now. Representative Bolden is absent. Senator Richardson,
Yes.
Mr. Fulton,
Yes.
Miss Massa,
Yes.
Representative Bomback,
Yes.
Chair Manning,
Yes.
Mr. Patel,
Yes.
Dr. Silver,
Yes.
Miss Tuxford,
Yes.
Dr. Lee,
Yes.
and Senator Poor.
Yes.
Thank you. So we have 1 absent and 10 yeses, so that motion carries. Thank you, Curry. And then we finish the tobacco prevention and control. We'll move back to the workforce development programs section, which we heard from Dr. Harp today, DSU, and then we heard from Polytech and Deltech at our last meeting. So where we left off here, there was discussion to fund the 2 Deltech programs. So that's the new nurse development program and the paramedic instructional program expansion. Fund both of those requests at 80%. We did not take a formal vote on that, so I want to open up to discussion of the committee members for this section.
I had a question. This is Autumn Tuxford. Hi. Okay, so I know that we funded it at 80% last year, and I thought that the intent was to continue to decrease year by year. So, but we're proposing 80% again this year. I apologize because I missed the last meeting. So this is me coming in looking for some update, but it was my understanding that it would be decreased again this year.
Yeah, I think the reason we went to 80% again was because our 80% recommendation was not accepted. So we were basically, stomping our foot again at the same amount. Going lower didn't seem like it was going to get us anywhere since it wasn't honored last year.
Understood. Thank you.
Sure. What I would say about these is, we've had some discussion. I think, Jules, I'm sorry, remind me again I thought we had voted on 2 of these. Had we not?
So we did not take an official vote.
No vote.
on
No
this.
vote.
No.
I see.
That was
Okay.
discussion.
I'm sorry. Okay.
No, it's okay. The only thing we truly voted on was that behavioral risk factor. The rest, we needed these formal votes.
Okay. So given that there's a discussion of 80% for Deltech, is the 80% something that the group wants to apply to all of these programs or not? And if not, then we have to address them individually. What's the preference?
I can make a motion that we fund them at 80% of fiscal 25 budget levels for all 4.
I'll second that. Done. Full.
Thank you both. Any discussion on the motion to fund all 4 of these at 80% of FY25 allotment? I see no questions or discussions. Jules, you want to call it?
I'm sorry, this is Autumn Tuxford again. It's not a discussion point. It's more of a question, I guess, of clarity. And I also apologize if this was covered and I had stepped away for the meeting. So just grace, please. I understand that these were suggested, which means that it's like, all right, that they're coming out of a different potential funding pot. Or there is the ability for them to come out of. Is the issue that whatever the other pot that they could be funded out of it's not being budgeted. And so because it's not being budgeted, they're looking for it to come out of this pot. So does is the question that moving forward, I get it that specifically like with the switchback things. I get it that it's like, that's a huge thing to take on because this department did not budget for that. Understood. We fund it this year, next year, put it in your budget so that you can fund it. Does my question make sense? I guess I don't.
It does. I think you're probably thinking about some of the state programs, the conversation that we were having in the general fund. And so that's a little bit of a different conversation. Our concern from the group has been, why was it not included in the general fund for state supported programs? But these are external programs that are funded by the institutions and universities that may or may not have access to additional funding. I hope I'm understanding what your question is about.
You are. I think at least last year, someone from Delta came to speak and said that it was told to him by I thought he said by the state, that he didn't honestly care where the money came from, that the state could have given it to him, but they didn't. So they told him to come to this fund. So
I remember that conversation.
Right. So I'm asking, is it because the state didn't budget for, like, that's where it should be coming from, but because it wasn't budgeted, then it was come here? That's the question, if that makes sense.
Yeah, I think that's the whole, I'm sorry. Go ahead, whoever was talking. I apologize.
It's Autumn. I'm sorry.
I can't see you, Autumn. So I'm sorry if I keep that. I can't see hands raised. I can't see people.
It's okay. It's okay. That's my question is, should it be coming out of a different, but that's the question.
I think this group wholeheartedly believes the answer is yes. And I think that's the conversation that, the reason, so it was Mike Jackson, Director Jackson, formerly Director Jackson of OMB, now at Del Tech, who came and said those words. And what he said was, I'm agnostic about where the money comes from, but we need the money.
Right.
And so, I think that's the issue, is these are workforce initiatives, but they're healthcare workforce initiatives. So at some point, and I don't know if we had the history on this, at some point I thought we did, but at some point, these were things that were either funded in part by these schools and were augmented by this fund, or they were switched over to this fund as these things happened because this fund was available. And, the state has a budget to balance. So I think that's this group's entire position, is that they shouldn't really be here, but we realize how important they are. These do benefit healthcare because it drives the healthcare workforce. So we're not going to not, cut it, or we're not going to cut it or recommend that it be completely cut. But that's why last year with Del Tech, we recommended an 80% cut to try to send that message. 20%. I'm sorry. Yes. And it was not acknowledged. So, we can only make the recommendations at the end of the day, but I think the group, at least the sense of the committee, is they totally agree with you that these should not be coming out of this fund.
Okay. Yeah, I was just trying to understand the logistics of, I guess technically, like I said, which agency within the state should be funding it. If it wasn't this, then what would it be? Was the more of the question, I guess. Right. If this fund didn't exist, where would they get this money?
Right. So that Del Tech would get it in their operating budget, and Polytech would get it in their budget, and Del State would get it in their budget. Okay. So it's essentially when OMB and the General Assembly has to decide where the funds are going, they look at all the available funds, right? And this fund is part of those of quote available funds. And I think that's the sort of dance we're doing here, because the fund is dwindling, and so now it's not just going to be us panicking. They're going to have to panic a little too, because the money's not going to be there eventually. Right. So I don't know that I added any clarity. I'm sorry.
You absolutely did. Thank you so much.
Welcome. Were there any other questions or comments?
I just think these are all good programs, but I don't think they should come out of this fund.
I'm also looking at, based upon the discussion, why we didn't recommend reductions in all of the programming in this column, why we particularly chose the Del Tech nursing program. if anyone has any additional information.
You were asking about last year, fiscal 25 recommendations?
Yes, why our recommendation was only lower for the first program.
It may have been due to participation in the committee meeting and additional information being shared by the other applicants. I can't, my memory is not that good that far back.
Yeah, I also
Well-
knew it was the size of.
Yeah. I mean, I'll answer the question because I asked the question to, what's the gentleman's name?
Mike Jackson.
I asked Mike specifically, I said, you know, and the same thing happened last year. We had dwindling resources. And I said, if we funded you at a lower level, would you be able to sustain the program? Because obviously we want nurses to be trained in Delaware, and they're a key, incredibly key part of our whole health system. And he said, yes, we'll run the program. We'll just get the money from somewhere else. Most notably, the general fund, because this process, our process, happens before the budget process is completed. So if they don't get the money from us, they'll add it to the request to the general fund. That's my sense of it.
And workforce is very near and dear to my heart, and something we're typically not comparing apples to apples, but this is a little bit closer to apples. And going forward, I would definitely want to have more metrics and be able to compare these programs to determine who has better outcomes and outputs. Of course, I like the approach of treating all of them similar with the 80% reduction, but if we have firm data, it would be easier for us to determine how we want to fund these programs if we want to fund them differently. That's just a comment for the future. I don't think we have the metrics to make a difference this year.
Well, we do have, I mean, in their applications, they are required to submit their expenditure reports and their budget documentation, and they do have whether or not they met their goals with the money they were given the year prior. And all of these programs were funded the year prior. So there is information in the applications, and they are different, I will say. I mean, they're not exactly the same thing. And in the case of Del State, certainly, like what they were proposing anyway, is well beyond what the other programs are. So they still, I do think we're in that apples, oranges, bananas situation, even though we're talking about workforce, because they're all doing things a little bit differently. But
Polytech, for example, is an evening adult education program.
Right. And Del State is working on the master's program and improving their training, and they're doing different things. So I think it's hard, and I think there's merit to all of them, absolutely. But I share that because it is a public meeting. I don't want people to believe that we're not making these decisions based on data and metrics and information, because that does exist. It is in the applications. And if it's not in the applications, Jules, we have pulled those applications and or requested it, correct?
This is correct.
Jules, hello?
Can you hear me? Can you hear me?
Can't hear you, Jules.
Oh, but
I
Mark,
can.
Dr. Okay. Interesting. Can't hear me?
Still can't hear you, Jules.
It may be out in the room because we can hear her on the
Yes.
virtual webinar.
Okay, now I'm in really big trouble because I can't hear Jules, and my fabulous assistant Sue has stepped away. So we are not in good shape right now, folks. Okay, so let me try and get us back to where we were 2 seconds ago, which is, the question is about I believe we had a motion and a second, and we were at the discussion point on workforce development, with the motion being fund all of them at 80% of the FY25. The basis of that being we have to make some cuts and we want to be equitable and there's a value in each of these programs continuing, even if we don't believe they are properly in this bucket. Is there additional discussion?
No, not hearing any. Secretary, can you hear me? I don't think she can hear me.
Okay, hearing none. Jules, we still can't hear you.
Paul, can you say something to see if she can hear you?
Madam Secretary, can you hear me?
Wait, I lost everybody. Can anybody online speak?
Yes,
No, I can hear him.
Hello, hello.
Yes.
Paul, are you talking? I can't see.
I am. Yes, I am speaking.
His screen's lighting.
Yes.
But
You're
we've
talking, but we can't hear you.
we have apparently lost audio here. That's the issue. I apologize.
I can hear everybody.
I can hear everybody, but I don't think they can hear
But
us.
you can obviously hear me, right?
Yes,
Yes.
we can.
Oh, you're
There
back.
you go.
Okay. Sorry
Okay.
about that.
Can you can hear us
Test,
now?
test. 1, 2,
Now we
3.
can.
Yes,
No idea what happened.
that was me. Hit a button.
Oh, never mind. We're good over here.
We knew Sue, you left and it quickly went downhill.
Yeah, Sue, don't leave again.
I said it would. She can't leave.
So yes, Chair Manning, thank you for summarizing that. I know last year there was more pointed discussions with Deltex since they had the larger budget as well. And yes, thank you for walking us through that, Secretary. I appreciate it. But we did leave off on that motion. I have it by Representative Baumback, with the second by Mr. Fulton, to fund these programs at 80% fiscal year 25 budget. We're going to go ahead and move forward with a vote on that if everyone's okay with that. Any other comments? Okay, seeing none, I'm going to run through. All right, Representative Bolden, absent. Senator Richardson,
No.
Mr. Fulton,
Yes.
Miss Massa,
Yes.
Representative Baumback,
Yes.
Chair Manning,
Yes.
Mr. Patel,
Yes.
Dr. Silver,
Yes.
Ms. Tuxford,
Yes.
Dr. Lee,
Yes.
Senator Poor.
Yes.
Thank you. That is 1 absent, 1 no, and 10 yeses. So that motion carries on the Workforce Development Group. Next, we've completed the Behavioral Health Program. Next is the Consumer Education Program.
I'll
So I
move that
do
we
have-
fund, I'll move that we fund this program at 80% of fiscal 2025 budget levels.
I'll second that.
Comments? Concerns from committee members? All right. I'm not seeing any. With that being said, we're going to move forward with the vote. Representative Bolden, absent. Senator Richardson,
Yes.
Mr. Fulton,
Yes.
Miss Massa,
Yes.
Brett Baumback,
Yes.
Chair Manning,
Yes.
Mr. Patel,
Yes.
Dr. Silver,
Yes.
Ms. Tuxford,
Yes.
Dr. Lee,
Yes.
and Senator Poor.
Yes.
Thank you. That is 11 yeses and 1 absent. We actually, 1, 2, 3, 4, 5. Sorry, 10 yeses, 1 absent, so that motion carries. Thank you, Clarice. Moving down our list, we did health-related programs, family caregiver programs. We have 2 in this section. This is caregiver program through Delaware. I'm going to pronounce this wrong. Ecumenical Council.
Ecumenical.
Thank you, Chair. Appreciate that.
Yep,
And
no
then
worries, I got you.
thank you. And then Easter Seals Recreation and Respite Care Services. I do want to do a quick time check as well. It is 4:41. We still have public comment. And then it looks like we still have switch fund programs to officially go through, finish up on the new programs, the innovation fund, and then the DHSS state operating fund. So I do want to have a quick time check before we move forward. We do have our meeting on Friday already held, in anticipation of needing some more time to vote. Chair Manning, I want to defer to you and the committee, but it does feel like we're nearing time on it, but we can keep moving forward for sure.
So I would ask, since we do have that other meeting scheduled, then we're not going to wrap this up today, that we go ahead and plan for that other meeting. But before we move to public comment, I do want to highlight the next two that we were going to talk about in the family caregiver program, because I had comments on both of those, and I would ask the committee members to go back and look at those applications and any remaining applications that we haven't talked about before the next meeting. So I just want to share my thoughts on those two things, and then we can, if anybody else has comments and discussion, that's fine. But we don't have to vote today because I want to make sure everybody has an opportunity to review everything, and then we can leave the rest of the business for the meeting on Friday. But my issue with the Ecumenical Council application was that they were significantly under their goal. They did not meet their metrics for the program that they had said they were going to meet. I believe they were 500 under the metrics, which is significant. And so I'm going to look at it again myself, because when you look at these over time, because there's so many of them, you don't immediately recall. And I tried to put notes to jog my memory, but my notes are 500 under goal. So I need to go look at that again, but I would ask everyone else to look at that as well. And then these are folks who provide great programs and great services. I'm not taking that away from anybody, but we have an obligation to look at outcomes and return on our investment and performance. And that's why we changed the application to get that data and information. So I really want folks to look at that. So same thing with Easter Seals. They're fabulous, but they didn't use all their funding last year. So I think we should take a look at that application when we make a decision on that. Those are my comments.
Madam Secretary, I've got the Ecumenical Council's thing up. Can you point me to where you see the shortfall in spending and goal achievement? Are you able to do that, or you can follow up with an email if you'd like?
Let me look if I can do it quickly. I'm happy to. Like I said, I kind of wrote the note on the top, and then
Yep.
Let's see here.
Yeah, on page 6, they talk about their budget and also their 2024 expenditures.
Yeah.
Now, we gave them 20,000 more for fiscal 25, which is still going on.
Let's see. I can't put my finger on it at the moment. I'll have to
That's
go back and yeah, that's just me noting that they received grant and aid as well for the service. But I can't find where I got that from. I wrote it on the front of the application, so I'm going to have to go back.
And also on page 8 at the bottom, they indicate that they're working to get a more consistent rate of referrals. So maybe that's tied to what you had learned, that they didn't get as much demand as they were expecting or something like that.
Yeah, I think I just did math based on the numbers they reported under program evaluation. That's my guess.
Okay.
Looking at those numbers there quickly, it looks, but I'll have to confirm that.
Great. Thank you.
Back. Yep.
Just because it's simple, well, I don't know, that's dangerous to say. Can we go down to, do you have past applicants at the bottom of this spreadsheet? Or new programs? Do we need to do a vote on the past applicants at 0, or since they didn't request it, we don't need a vote there? Is that correct?
Yeah, we shouldn't have to vote on those. We just wanted to illustrate past applicants that didn't put it in an application.
Perfect. And is there there's a new programs.
So the new programs is defined as 2 years or less. So I believe the top two, this is their second year applying, so they'll be moved into another category next year. That's the goal, is to keep things flowing through this new program, unless the team would like to see this for longer. But that was just an internal discussion. We decided because as some of you may remember, last year we had like 10 or 12 new programs that had been around for quite some time. So we needed to move that out. So with that, the behavior risk factor surveillance, we did take an official vote to fund that at 0. To not fund it, essentially. The other ones we did not take a vote on.
Okay, I think that's as far as we're going to get with this today.
Okay. All right. So, let me pull up our next thank you everyone for engaging in this conversation. This is exactly what we need. We're making some funding recommendations. We will do our best to tie all this together, get this version out that we have so far funded, so you all can see that summary, play around with it yourselves. And then there was a request by the secretary just to take a closer look at the remaining programs we have left to do final votes on. But the next meeting is going to be on Friday. Apologies for picking a Friday. We had a lot of holidays to work around this year. And then, as Secretary indicated, our final report is due November 15th. So our goal is usually to have the last meeting by that first week in November. So we have some time to craft a report, send it to all of you for review before we send it to the General Assembly. So our next meeting and final meeting will be Friday at 10:30 a.m. to 12:30 p.m. A 2-hour meeting, hybrid as well. I'll be in person. Sorry, Chair Manning will also be in person. Anyone is welcome to come in person. With that being said, if there's no other comments from committee members, we will move over to public comment to give our public a chance.
Jules, I just want to mention with what you have on the screen, that 18.3, that is 78% of the sum of our projected payment plus projected interest. So without doing any of the switch funding or DHSS operating, we've already in our recommended the obligation of 78% of the projected flowing income to the fund in fiscal 25.
Thank you for that summary. I appreciate it. Give a visual of where we're at already in the funds we have used up on our voting. So thank you, Representative. Are there any other comments before we move to public comment? Okay. So if you're a member of the public and you'd like to provide public comment, if you could please utilize the raise hand function on Zoom. And then if you're in person, you can check in with Sue Bailey for public comment in person. If any of our panelists, who Greg or Dr. Harp, if you're on and want to give public comment, just shoot me a message in the chat and we can give you that opportunity. Sue, is there anyone in person for public comment?
No. Oh. No,
Okay.
no, there's not.
Thank you. All right. So virtually I have Lance Kilpatrick. I am going to give you the ability to speak, Lance, and then you can provide public comment. You should be able to speak.
Thank you very much. And thank you to the advisory committee for all the work that you have done today, in the past, et cetera. You were making very difficult decisions with limited funding, and it is certainly appropriate to be considering what the future looks like for this fund and the ability to appropriately and effectively fight cancer and big tobacco, neither of which seem to ever stop fighting against the goals that we have to create healthy communities going forward. So I want to thank the advisory committee for suggesting 100% for fiscal year 25 funding. and going forward to keep up the good fight, to keep expanding resources as much as possible, because the fight never stops, and we do eventually need to win this fight. So thank you for everything.
Thank you, Lance. Alex, I'm going to give you the ability to speak, and you can unmute yourself and go ahead.
Hear me?
Yes, we can.
Perfect. Thank you. Thanks for the opportunity to just provide some really brief comments. I'm Alex Casper, the Director of Advocacy for the American Lung Association. For the record, we understand the committee has had a huge undertaking and appreciate the thoughtful and strategic discussions you all have made today and decisions. We are pleased that the committee continues to make significant commitments to tobacco and cancer programs, and thank you for that ongoing commitment to prevention work. Thanks for the opportunity to always be a part of the process and your continued support.
Thank you, Alex. Looks like Dr. Miller, I'm going to give you, there you go. You should have the ability to unmute yourself.
Good evening. I just want to say thank you to the advisory committee for all that you are doing and for your support. I am the maternal and child health clinical director here at Medicaid, and the program in particular that I am in charge of, so to speak, is it just says social determinants of health, but I want to just make it clear that this is something that is addressing food insecurity amongst pregnant and parenting women, people, and their children. We are providing meals and healthy options, healthy fresh vegetables and food and fruits and options for women who just had babies. And we have those meals for the entire family. We provide those for a 12-week period. And a lot comes from that, including encouraging well child visits, encouraging that postpartum visits, and decreasing postpartum depression. We also most recently were acknowledged. Our 1115 waiver is only one of 2 states that provide diapers and wipes within that package, and within this benefit rather. This is significant. Tennessee is the only state, but they do not provide the meal. They do not provide that healthy option for families. And I just want everyone to just really think hard about this benefit. It is just something that has been significant. We are going into our second quarter with this, and we've had more than 300 families utilizing this benefit. We really need these funds. So I just want to say thank you. I recognize that you have a hard job to do here. And there's a lot of great programs to look at. I just want to make sure that everyone is looking at ours and understanding how valuable it is, especially with women now in this very moment, who really need this support. That's it. Thank you.
Thank you. Chair Manning, on my end, that concludes public comment virtually.
That's great. There's no others in the room here. So with that, I'll entertain a motion to adjourn.
Make a motion to adjourn.
Thank you, Mr. Patel. Is there a second?
Second.
I'm not sure who that was. I'm sorry.
Representative Bomback.
Thank you, Representative Baumann. All in favor?
Aye.
Aye. Okay. Thank you, everyone. Have a great night. We'll see you
Thank
Friday.
you, everyone.
Bye-bye.
Thanks. Good night.